I'm Dr. Rosalyn George, board-certified dermatologist and owner of Wilmington Dermatology Center in Wilmington, North Carolina. Today we're going to be discussing Cellfina, which is a revolutionary device for the treatment of cellulite. Cellulite is the bane of many women's existence. It doesn't matter if you are a little bit overweight, if you're super skinny, 80% of women are affected by it, and it's really not changeable by diet and exercise. It's one of those genetic things that just is there, and the only way to effectively treat it is to get to the root cause of cellulite. People are so kind of wary of what the treatments are because we've been sold creams and devices and rollers that were supposed to work, and really, if anything, only gave us a temporary improvement. So why is Cellfina different? Cellfina is different because it actually, I kind of joke with my patients that it really dumbs down how we're going to treat it. And what it does is it has a little suction device, and we make a little insertion point and release this band. And when I say band, it's really what we call fiber septi. So men have a nice lattice work. So theirs is like a net holding all the fat down underneath their skin. Well, unfortunately, women is more of this perpendicular fiber septae. So what we're trying to do is release that band underneath the skin so then the skin smooths out. So in order to do that, you come into the office, we look at the patient. It's really optimal for the buttocks and the backs of thighs and sides of thighs. It has to be the dimply cellulite. So you really have to have the little divots. It's not as great for the ripply cellulite. You can improve that somewhat, but it's not quite as good for the little dimples. Buttocks, backs of thighs, sides of thighs, home run almost every single time. Patients will see the results in as little as 3 days. Most patients, it takes about a month for all the little bit of bruising and swelling to completely heal. And in my experience, the results at 3 and 6 months are even much better than the results that you have at a month. And now we have FDA data that shows that up to 3 years that this is pretty permanent with a 96% patient satisfaction, which is really unheard of in a lot of cosmetic procedures. Part of the process is you come in, we mark those little dimples. I'm going to look at them, our staff is going to look at them with me, and you're going to look at them at the same time, so we make sure that we're not missing anything. We want to make sure we're treating all of the dimples. Once that's done, once the marking is done, we take you to the Cellfina suite. You're relaxed on the table. We give you nice headphones so that you can listen to some relaxing music, and then we use something called tumescent anesthesia to actually numb the area. And the reason we use something called tumescent is because we can use a higher amount of volume so that we can treat all the areas in a safe way to not put the patient at any risk of having any side effects. There's a suction cup that kind of sucks the area up. That basically your body can only process one signal at a time, so that suction really decreases the amount of discomfort the patient has. Then we make the little insertion and we release the little band, and that process takes about an hour. It's really an hour-long procedure. You do have a little bit of downtime. I would say people are pretty uncomfortable for the first day, a little bit of soreness, mostly to the touch if you go to sit down on a chair, but you can get back to your normal activities relatively quickly and see results in as little as a week. It really is one of our favorite procedures, and it's the first thing that I can confidently say really works on cellulite.